Good morning, I'm Adam Sexton. Veterans are already a vulnerable population in terms of health and well-being. Beyond the immediate danger of COVID-19, the stress of this pandemic has been particularly hard on those who serve their country, for whom unseen threats and widespread loss of life can reawaken past trauma. Here this morning to discuss how the VA Medical Center in Manchester is handling the COVID crisis is the director, Kevin Forrest. Thanks for joining us, Mr. Forrest.
Morning, Adam. It's great to be here this morning.
So you've been on the job since last June. And what's been the biggest adjustment in terms of trying to not just survive, but to continue providing care through this pandemic?
Well, Adam, I think it's, working with the staff to make sure that we balance all the priorities we've had through this pandemic. First and foremost, making veterans receive the care that they need, and balancing that with COVID operations and vaccine operations and our VA fourth mission requirements of helping others in the community. It's just a constant ongoing, coordination effort with everybody to make sure that we provide that care for veterans.
We know that you have a community living center there, and that, of course, is the population in the greatest danger through all of this. How have they been doing?
They've been doing very well. Adam, it's a credit to the staff here in the facility that we've been so fortunate to not have any COVID infections in our community living center. And I credit, the staff and all the protective measures that many people in the facility here identified and put into place right up front in order to protect our CLC veterans.
Before the pandemic, we were talking a lot about the epidemic of veteran suicide. What's your perspective on this? Has that work been able to continue, and how have you been able to break through the isolation that this pandemic has enforced on all of us?
Well, it certainly was first and foremost in our thoughts to all veterans and doing everything we can to prevent veteran suicide. Just this week, we're working with our Designing for Zero team, which is our strategy to prevent veteran suicide. And I think we look at a whole approach where everybody in the facility plays a role in preventing veteran suicide. And we meet with everybody. We let them know, regardless if they're in an administrative role or a clinical role, we all play a part.
And this crisis is not one of those adrenaline shot crises. It has its moments, of course, but it's a slow motion disaster. Can it still, in your opinion, reawaken issues of PTSD for our vets?
Oh, it certainly can. As all of us have had to, be careful and not be able to go out and have to stay at home and not have the friends and family and kind of comrades that we're all used to having, that can certainly be a trigger for certain effects in veterans and others as well. And that's why, our mental health teams do such proactive reach out to our vulnerable population to make sure that they're okay.
You mentioned the environmental health teams. I'm curious, the mental health goes hand in hand oftentimes with homelessness, and that's another issue for veterans as well. How has that outreach been impacted by COVID-19?
So we have, our homeless teams that do this proactive outreach into the community. They know our veterans, they follow up with them, make sure that they get the care that they need. And it's just, really amping up our connection out there and letting them know that we're here for them and resources are available.
In terms of vaccination now, a positive spin on all of this, it's calling all veterans right now. How's that process been going at the VAMC?
It's been going great. Very, very busy, but, proud to report that, we're looking at, upwards of 22% of our enrolled veterans have received a vaccine so far. And a lot of that is a credit to, the VA New England healthcare system and our director, Mr. Ryan Lilly, for employing all of the VA medical centers here in New England to help each other out and deploying vaccine teams around so that we can get everybody vaccinated as soon as possible.
I'm just curious here, are there any differences between service eras in terms of who's more willing or less willing to get a shot? You got World War II all the way through the global war on terror.
Adam, I think I've seen overwhelming majority of veterans, regardless of age, wanting a vaccine. And, we certainly started vaccinating our more vulnerable population, which are our older veterans, at the beginning of all this. But, a couple of weeks ago when we noticed that I think it was more prudent with the vaccine supply increasing, that we open it up to all veterans, because our main mission is to get those vaccines into arms as soon as possible.
This is always an issue, I think, but do you feel like you're getting sufficient resources from Washington during this crisis?
We've been supported, with vaccine, with PPE, everything we've needed. Again, my higher headquarters, the VA New England Healthcare System in Washington, it's been great communication multiple times a week where we have an avenue to request resources or bring up any issues, and everybody is very responsive in helping us.
What about staffing? We know that that's something every medical facility is dealing with as a problem right now.
So I certainly haven't slowed down hiring at the Manchester VA here. We brought on upwards of 50 new staff to help us during our fight against COVID for, additional providers and vaccine team staff and screening staff. So we are continuing to hire both clinical and administrative positions here at the Manchester VA.
I know with the vaccine, some of that has to be refrigerated to an extremely cold temperature. Have you had to adjust anything in terms of refrigeration? I know you do have a goal of getting vaccine shots into arms within a week of receiving the shipment.
We do. I mean, we set up new freezers to be able to make sure that we can safely store the supplies, and except for getting those freezers into place with the appropriate monitoring systems, we haven't had any issues. And we use the Manchester VA as kind of a home base for our storage, and when we go out into the community, whether it be like Portsmouth last weekend or we're heading up to the Conway area tomorrow, we bring that vaccine with us and haven't had any issues so far. So it's gone pretty well.
Every medical facility has had to adjust so much. What's your outlook in terms of when you'll be able to get a little bit back to quote unquote normal in terms of having people come in and out of the building?
Well, Adam, I think we've already started. Certainly as we've had more veterans and staff vaccinated, we're looking at increasing the number of face-to-face appointments here in the facility, which is what veterans want and deserve and what we're used to. But clearly, as we bring more veterans in, we've opened up our surgery suite and we're doing more surgeries. We want to continue leveraging our telehealth platform, VA Video Connect, as part of our ongoing care moving forward, because it's important. And there are many veterans that find that if they can do a virtual appointment and it eliminates a need to travel to the medical center and they get what they need, we want to still be able to offer that. And I think that that's something that COVID really pushed on us, is to use these virtual telehealth modalities, and that's a good thing, and we'll continue leveraging that in the future.
I want to return to that telehealth in a little bit, but I know this has been a triage situation from the beginning. Are there any programs, services, ideas that you wanted to implement that have been deferred that you're looking to bring back into the mix here in the next 12 months ahead?
Well, I know that, one thing is it was hard having our volunteer workforce, not be in here during that time. Many are older and more vulnerable, but everything that we've done with our community and some of the gatherings, being able to bring that volunteer workforce back in it is really important to us and our veterans. I think we all miss each other.
I know you're a veteran, but in addition to that, you're also a New Hampshire native. You went to UNH. What does that do in terms of bringing the perspective that you have to this job?
Adam, when I retired out of the Army and moved back to New Hampshire, to me, this is really the dream job. I mean, for me, I took care of veterans for 20 plus years in the Army Medical Service Corps, and to be able to move back and continue serving veterans, I really say in my VA is really special to me. And I just feel it's my duty and obligation to I take that responsibility very seriously and come in every day just knowing I want to make care better for veterans.
And before the pandemic, when we would have your predecessors on, and we would often talk about the reform process going on at the VA-MC Manchester with the whistleblower issues that were brought up in 2017 in terms of patient care. Where does that process stand now? And you mentioned the telehealth. Is that going to be able to kind of knock down potentially some of the wait times that vets were facing for care?
Well, it certainly does. I mean, it gives us a great opportunity. We also have a lot of initiatives leveraging the other VA medical centers in New England with our clinical resource hub. So it's not just whether we have the care here in Manchester, but being able to use those specialists throughout New England and frankly throughout the VA to improve access.
Are you satisfied with where that process stands now in terms of what began in 2017?
Yes, we continue moving forward. I'm excited to cut the ribbon on a new urgent care and mental health center towards the end of the summer here. and open that up for our veterans. And, that gives way for more expansion here at the Medical Center to bring in more clinical programs to help serve veterans.
All right, VAMC Manchester Director Kevin Forrest, thank you for your service and thank you for your time.
Thank you so much, Adam, and thank you to all our New Hampshire veterans out there for entrusting us with your health care. It's truly our honor. Thank you.
All right, thank you.